Today I want to talk to you about gestational diabetes. So we will be looking at exactly what it is. We'll be looking at some risk factors associated with this condition and also how exercise can be implemented to increase safety and long-term health outcomes for both the mother and the child. So gestational diabetes, it is a type of diabetes that occurs obviously when a woman is pregnant, and it occurs or is more likely to occur due to the changes in hormones during pregnancy that play with our insulin sensitivity and our glucose tolerance. Now, it's usually diagnosed after the 24-week period once the mother has undergone the oral glucose tolerance test. And this condition, it does have some risk factors associated with it. So if we're looking at why gestational diabetes, should be avoided or should be closely monitored, is that it does increase the risk factor for developing preeclampsia. So this is elevated or high blood pressure during pregnancy. And this can flow on to serious consequences for both the mother and the unborn child. We also understand that having gestational diabetes increases your risk for developing type 2 diabetes after pregnancy has occurred, and it can also contribute to a low birth weight for the baby. It can also lead to hypoglycemia for the baby too, so that is low blood glucose levels. Some risk factors for developing gestational diabetes include a history of having gestational diabetes in a previous pregnancy, having a family history of gestational diabetes, poor diet. These are some risk factors that can contribute to the likelihood of a person developing this condition. Now, how exercise can assist in reducing the risk of developing gestational diabetes or reducing the, level of gestational diabetes if it has been diagnosed, is that exercise can significantly help to increase insulin sensitivity and reduce high blood glucose readings within the blood. So we know that exercise has a really positive health benefit on normalizing blood glucose levels, which is going to have a flow-on effect to the risk of developing that diabetic condition. So if we're thinking about exercise, how much we should be doing, it's advised that at least 150 minutes of exercise is completed weekly. So that's about 20 minutes a day. And this should be a nice mix of strength or resistance-based work and cardiovascular work. Now, there are some considerations to be made as a pregnancy develops. So it's really important that you speak with your GP or an exercise physiologist just so you can understand what is safe as your pregnancy develops.